Welcome to Serving Up Science with Skeeter. Stay tuned for today's topic, stem cells in veterinary medicine.
Did you know that almost all animal cells can be repaired or regenerated by the direct action of stem cells? But what is a stem cell? Stem cells are identical cells that are able to withstand infinite amounts of mitotic division. In their original state, they are unspecialized, so they cannot perform a particular function. They have the ability to change into an extensive number of specialized cells, which makes them beneficial to the medical world.
The most successful stem cells used are from bone marrow and adipose tissue. When a stem cell divides, every new cell has the ability to continue as a stem cell or develop into a different cell with a specialized function. These cells ultimately serve as a repair system for the body. In a normal procedure involving the use of stem cell regeneration, between 200,000 to 40 million cells are obtained for the patient's use. Stem cells present a high therapeutic potential and may be injected as autologous or allogenic, freshly isolated, or previously cultured. Autologous means that the cells are obtained from the same individual, and allogenic means that the cells are obtained from another individual. Not only is stem cell transplants important for the healing of animals such as racehorses, but it is also useful to do testing on animals before humans.
Now you may ask, how is bone marrow collected? Bone marrow is a soft, fatty substance in the cavities of bones where blood cells are produced. Bone marrow has produced two types of cells, hematopoietic, which can produce blood cells, and stromal, which can produce fat, cartilage, and bone. It is collected by an aspiration biopsy puncture in the sternum of horses and in the femurs of cats and dogs. Then the collected bone marrow samples are sent to the laboratory where they are centrifuged. The purpose of centrifuging them is to separate the mononuclear or bottom layer of the blood. It is just one step in purification. This fraction of the bone marrow can be prepared in syringes with the purpose of direct application into patients.
The advancements of stem cell therapy in veterinary medicine are amazing, but like all medical procedures, there are some disadvantages that go along with it. Stem cell therapy is fairly new, so the information and research done is limited. Many veterinarians are not yet confident enough to use this technique. There's not enough research done to be fully aware of the side effects, which also deters some veterinarians. Some of the known side effects include nausea, vomiting, fatigue, hair loss, anemia, infection, digestive system problems, and bleeding. Stem cell therapy is extremely expensive. Only large-scale hospitals have the funds to complete the process. Unlike it is for humans, the procedure for animals is not likely to be covered by any insurance company, therefore many people have trouble affording it. At the beginning of this video, you briefly learned about adult stem cells. Embryonic stem cells are much like adult stem cells, but they come from the embryo or umbilical cord blood of newborn babies. A large ethical argument against stem cell therapy is that embryonic stem cells require the death of an embryo. Embryonic stem cells are commonly used because adult stem cells are harder to use. There is also the possibility of rejection if the stem cell from one patient are injected into another patient.
What are some future advancements in stem cell research? Animal Cell Therapies, a veterinary stem cell development company, is on the path to an FDA approval for selling hematopoietic stem cells that are harvested from umbilical cords. These stem cells will be used to help cure tendinitis and other joint issues commonly found in dogs. Clinical trials trials are being conducted in various locations to test chronic problems, which include efficiency and safety issues towards the animals receiving the treatments. The process may take a while, but very few problems should occur in the ethics department due to the fact that they only use stem cells from umbilical cords of newborn puppies whom have been delivered by C-section. Permission is always asked before the umbilical cords are collected.
Now that you know a lot about stem cells in veterinary medicine, you might be wondering what the importance of this science is. Evidence is showing more and more successful transplants in animals such as horses and dogs. The success rate for stem cell transplants in horses is up to 90%, with 20% healing up to 100%, and the other healing to over 75%. But how does this come into play with humans? It would be advantageous for us to heal faster, have reduced amount of scar tissue, lower chances of re-injury, and have stronger tendons as well. Stem cells offer other options. While they are extremely expensive, it is an option that has the ability to help many animals, and in the future, more people too. With more testing, this may eventually be a reality. It is important to keep manipulating stem cell tests in animals and raise success levels to the point where scientists are confident in the new technology to use it on humans.
Thanks for watching Serving Up Science with Skeeter. See you next time!